So we've seen the AED before. An AED stands for an automatic external defibrillator. Delivers electrical therapy to the heart to restart it or basically put it back in a normal rhythm. The heart is controlled by electrical impulses. So even though it's a muscle, it has electrical impulses in there that fire off to keep it to contract and keep it in sync. When it gets out of whack, that's why we use electrical therapy to shock it back into a normal heart rhythm. What I've noticed with these devices, it's usually CPR, shock, and medications that bring the people back. It's usually not just one or the other. It's usually like a combination of things. These are designed for people that have never used them before. There's a power button and a shock button. This is a training device, so it's got a couple extra features. It also has a voice prompt. Once you fire it up, it starts talking to you and guiding you through the whole process. Open up the AED.
Unit okay. Adult pads. Stay calm. Chest responsiveness. Call for help.
These pads go on the chest. They have the pictographs, so you can't mess it up.
Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest.
It's a biphasic shock, so it shocks in both directions at the same time. And for the child, placements like that. You sandwich them together. So front. Usually there's two types of pads. The pink ones are usually for kids, 8 years of age or younger, or 55 pounds or less. Or for the adults is usually the white ones.
Pediatric pads. Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest.
We ever seen a pacemaker? Pacemaker looks like a little puck. If your patient has one, you put the pad above it or below it, but never right over it because you can damage it. And if they have a medication patch, you're supposed to remove that, wipe it with gauze, then put the pad. In my pouch, I have scissors, gloves, gauze, a face shield. And I'll show you how to use that face shield. They have a razor as well. So if they're super hairy, then you're going to shave them in the areas where the pads are going to go. You're going to waste more time if you put the pad on them and the hair's up to here because it needs skin contact. It won't analyze a heart rhythm. The face shield is a piece of plastic with a one-way filter valve right there. It will allow me to blow into my victim's mouth. However, if he were to vomit and I'm making out with him, it's going to stop right there. It's a one-way like flapper valve. The face shield goes around the victim, not around me. You have to do what's called a head tilt chin lift. Head tilt chin lift, you pinch the nose, 2 fingers on the chin, tilt the head back. That moves the tongue out of the way, opens up our airways, so when I blow, it causes a rise and fall of the chest. That's what we're looking for. Rescue mask or pocket mask also has a one-way filter valve. It has a head strap, and then the face piece, wide part goes to the bottom, pointing part to the nose. This one you put over the patient's face, head strap over the head. You use what's called the EC method. The E goes on the jaw to tilt the head back. The C presses down to create a good seal. And then I'm gonna give a 1 second breath. The most common issue I see with people is they don't create a good seal. And if you don't create a good seal, all that air just goes to the side.